So the key message of my presentation today is that we have model diseases that reflect chronic inflammatory processes that take place in atherosclerosis, and the major disease entities are respiratory infections, which reflect an acute response of the adaptive immune system, and rheumatoid arthritis, which reflects chronic inflammation based on changes in the innate immune system. So there is firm evidence from observational and intervention trials that influenza vaccination is effective in preventing cardiovascular events in elderly people who are at risk for an increased rate of cardiovascular disease and events. Well, the major improvement during the recent years took place in the field of therapeutic regimens in patients with early rheumatoid arthritis. So if you start very early with an anti-inflammatory therapy, you also reduce cardiovascular risk in these patients. Yeah, there have been a few data demonstrating that the vascular function can be affected by inflammatory bowel disease, also by changes in the microbes in our mouth. But these changes are only transient in nature, and they do not exert any sustained effect. So, therefore, the bottom line is that the risk of cardiovascular events is not altered by these disease types.